Good morning, dear colleagues. Uh, I'm glad to see all of you in the webinar that are organized by Crystal Vision Eye Clinics by Professor Igor Aznorian. It is a series of webinars in the field of ophthalmology that are going to show different approaches in surgery and conservative treatment as in pediatric ophthalmology, so in adults ophthalmology. Each Wednesday at 8 a.m., we are glad to meet you here and to discuss different problems. So today our webinar is about restoration of kids' vision in kids with strabismus. We all know that strabismus it is not only a cosmetic defect. Not only not right alignment of the eyes, but it is a very deep functional disease that brings us to not having a binocular vision and stereoscopic vision of the kid. So the problem of restoration of binocular vision is very important, and in different countries there are different approaches. So we know that there are orthoptic organizations in Europe, US, Asia. In Russia, we use also orthoptic and diploptic exercises for restore binocular vision. So today our webinar will be held by very smart and great pediatric ophthalmology, Alina Idrisova. She is the head of Crystal Vision eye clinics, three of them in Moscow. And today her talk will be about the vision therapy in kids with squint. Uh, what devices, what exercises, what different procedures we can do for restore binocular vision, what is the technique, and how we all can help kids and their patient and their parents to start this treatment as more earlier as better. So, Dr. Alina, please, we meet you. If any one of you will have a questions during the talk, please don't hesitate to put them in the chat or in the webinar. We will answer to all of them, and we will be glad to see them. Thank you.
Good morning. Thank you very much, dear Sati. Dear colleagues, I'm glad to welcome you this early morning at the webinar hosted by Crystal Vision. My name is Alina Idrisova. I'm ophthalmologist and strabismologist. I specialize in the treatment of strabismus, refractive pathology, and another eye diseases. Today we will talk about methods of diagnosis and complex treatment of strabismus, the ultimate goal of which is to restore binocular vision. To date, there are no universal standards for the management of strabismus worldwide. Strabismus is a common eye condition in which the eyes do not work together properly, causing them to deviate from the same point of fixation. Affects from 3 to 6% of the worldwide population. The task of an ophthalmologist specializing in strabismus is to restore the following parameters. First one is the proper eye alignment. Second is the high visual acuity. Third is binocular vision. At the Crystal Vision Clinic, under the guidance of Professor Igor Aznorian, We have developed a standard treatment protocol for strabismus that takes into account the latest approach to ensure rapid rehabilitation for patients. Everyone knows that the main goal of strabismus treatment is not only to correct the position of the eye, but also to restore binocular vision. We often modern comprehensive technologies for the diagnosis, treatment, and surgery of strabismus. It's about high precision diagnostic of oculomotor function, customized calculation of strabismus correction by Strabismus system, low trauma strabismus and nystagmus surgery, current method of strabismus function restoration. In our network of clinics, we provide not only standard diagnosis examination for oculomotor disorders. In addition to the traditional and mandatory exams, as Synapta-4, we also offer the use of video oculography. This device allows us to accurately determine the angle of strabismus, both with and without eyeglasses, as well as to determine the characteristics of nystagmus and locate the null point of oscillation in eye movements. The device was developed by Professor Igor Aznaurian and the team of researchers from the Association of Children Eye Clinics Crystal Vision. In collaboration with developers from Barcelona and significantly increases the accuracy of the angle measurements. The GAZE lab is a significant development in the field of strabismus diagnosis. This device has no disadvantages of a Synapta-4. It allows you to observe eye movements in the natural conditions. Deviation assessment occurs automatically and all directions of gaze. You can accurately estimate the angle of deviation at any distance and in patients with low vision acuity. This allows you to evaluate the objective angle of strabismus and the amplitude and frequency of oscillatory movements of nystagmus. Not only horizontal and vertical components of strabismus are evaluated, but also cyclodeviation. Another development which is essential for planning strabismus surgery is the mathematical modeling system called Strabosoft. When modeling surgery for horizontal component strabismus, this system takes into account all anthropometric and physical parameters that affect the magnitude of the postoperative strabismus angle. Using this software, the surgeon can automatically simulate the dosage of surgery required for the patient, as well as the number of stages at their sequence. Additionally, the surgeon can use this program to demonstrate the planned result to the patient and a model before the procedure. During the planning stage of surgery, thanks to our software, we can accurately determine the angle the patient will have after surgery. We can then show the patient the expect outcome. However, precise diagnosis and calculation are undoubtedly insufficient if the surgical technique itself does not ensure high accuracy of the intervention. Just for this purpose, we have developed a special minimally invasive surgical technique, which involves adhering to a number of conditions. Please start video. Thank you. To create access to the muscle, we do not use cuting instruments like serous and scalpel. In our practice, we use a radio wave knife, which dehydrates cells, resulting in tissue dissection with simulation coagulation and without heating the electrode and any physical manual pressure. The incision is made in a way that preserves the muscle sheath, ensuring minimal development of adhesion process in future. And we use 7.0 vicryl threads as a suture material. The suturing is done with a special right hook with a groove, which helps avoid sclera trauma. We have been satisfied using Strabo technology for nearly 20 years, during which time we have treated over 1,000 patients. And this low trauma technique has led to a significant reduction in postoperative hyperemia and tissue edema, as well as a substantial decrease in time required for patient rehabilitation, which an almost complete absence of adhesion. As illustrated in the slide, the surgical approach allows us to reduce postoperative swelling and tissue congestion in more than 90% of cases, and the recovery period can be shortened to 3 days or less. You can see on a photo on the slide. Strabismus treatment principles is about stimulate awareness of diplopia, to reduce suppression, to develop sensory fusion and stereopsis, and includes binocular vision therapy and orthoptics. About retinal correspondence, we have to talk retinal elements of two eyes that share a common subjective visual direction are called corresponding retinal points. All other retinal elements are not corresponding or disparate with respect to a given retinal element in the fellow eye for a particular vision direction. To put in simple terms, the corresponding retinal points are points located in paired difficult places on the retina of both eyes. They have a same meridians and the distance from the central pits. When the retinas of the eyes are supermost on each other, their corresponding points will be conceived. Retinal correspondence can be of two types, normal retinal correspondence and abnormal retinal correspondence. Retinal correspondence is called normal when both of fovea can a common visual direction and the retinal elements nasal to the fovea in one eye corresponds to the retinal elements temporal to the fovea in another eye. I will try to show you. On picture. Okay, I can't paint. Okay. Another type is abnormal retinal correspondence. Retinal correspondence is abnormal when the fovea of the one eye has a common visual direction with the extrafoveal area in the another eye. This is generally seen if the angle of squint is small and the extrafoveal points is close to the fovea. After surgical correction, when orthotropy on an angle of strabismus close to orthotropy is achieved, it is possible to begin restoring binocular vision. The main purpose of orthoptic exercise is the development of visual ability, bifoveal fusion or fusion reserves. However, they have a number of features and disadvantages, such as the presence of two separate fixation test objects for the right and left eyes, and not one is as in natural conditions, causing rivalry of visual fields, lack of condition for bifixation, and control of empirical depth factors. Inconsistently of the installation of visual axis with the location of tests in space, thereby contributing to the formation of haploscopic rather than natural binocular vision in the patient. Therefore, orthoptic treatment methods can restore binocular vision only in 25-35% of cases. Thus, features of orthoptic treatment methods allow them to be used only at the um, initial stages of restoration of binocular vision. After the fusion develops, we enhance the treatment and add the diploptic exercises. The task of diploptics is to develop the patient's ability to overcome the perceived double vision by restoring the mechanism of binocular vision fixation, bifixation, which underlies normal human binocular vision. As for the development of bifixation reflex, the treatment consists in arousing double vision in the patient in natural conditions by irritating various disparate areas of the retina and developing the ability to merge a bifurcated image by transferring its projection on the fundus to corresponding additional areas. With the development of a fusion reserve, The patient is offered to merge two images of an object that arise after the nurse or doctor specifically separate the image of the right and left eye using prismatic lenses. The power of prism is gradually increased until fusion is no longer possible. The method of restoring the bifixation reflex, called bifixation reflex development exercise, provokes diplopia using prismatic lenses of various power presented in front of one eye in natural conditions when fixing a test object. That causes irritation of various disparate areas of the retina, simulates the fusion reflex of bifixation, and leads to the fusion of double images by transferring their projection to corresponding areas. To provoke diplopia, prismatic lenses of high power, 8 or 10 dioptries, are presented with the base to the nose in front of the leading eye when fixing any test objects, for example, a circle with a diameter of 1 or 1.5 centimeter. After several exercises, the prism is placed with the base to the temple. After excitation of diplopia, they proceed to the stage of development of bifixation, merging of double images, for which weak prisms are used, starting from 2 prism dioptries and gradually increase their strain up to 8 or 10 dioptries. Eduard Avitisov and Tamara Kashenka developed a method of separating accommodation and convergence, a method of dissociation, which, unlike the previous one, provides binocular control. The method provides a comprehensive effect of the accommodative diffusion ability of the eye. In this case, double vision is exceeded due to the load of spherical negative lenses of increasing strength with the same degree of convergence when fixing a 4-point red-green test with 33 centimeter worse test, which provides control over binocular vision. The effectiveness of the method was achieved in 46% of cases. A logical continuation of the previous methods was a diploptic method of treatment based on the development of fusion reserves, positive and negative, in free space when fixing the test object using prism of gradually increased strength, base respectively to the temple and nose. Prismatic ophthalmocompensator. This method is used at the final stage of strabismus treatment, provided when the eyes are aligned and bifovealar fusion is achieved on a synaptophore. Professor Igor Aznaurian managed to make a real breakthrough in the issue of fusion development in 2016 when he proposed using liquid crystal glasses technology for this purpose. The improvement of the design of glasses which were previously used to to treat amblyopia, and the expansion of their software capabilities made it possible to use glasses just as effectively in the management of strabismus. The treatment takes place in comfortable conditions and without time limits. That's very important for treatment, for strabismus treatment. With Strabo glasses, patients can do their homework, watch TV, play favorite video games, study, work, uh, lead a normal lifestyle, and be treated at the same time. We conducted a clinical study that include 99 patients operated on for concomitant convergent, permanent accommodative, and non-accommodative strabismus in the children eye clinics Crystal Vision. These were patients from 4 to 10 years old. The stage of orthotropy, when measured on a synaptophore, the residual angle of strabismus was no more 10. Patients in the main group were treated with Strabo glasses, worn daily for 4 hours until sensory fusion was restored. Patients in the control group underwent orthoptic treatment for a course of 10 days every 3 months. At the same time, it is important, and I repeat again, that all patients had proper eye alignment or close to it, which creates a required condition for the sensory fusion development by both methods. According to the results of treatment, sensory fusion was restored in the main group in 70% of cases, compared to 21% in the control group. Thus, this study provided the possibility of more effective orthoptic treatment of strabismus in children using Strabo oscillating glasses. A corresponding patent has been obtained for a treatment method for restoring sensory fusion. This is modern method that allows the patient to restore binocular vision comfortably. Thank you for your attention, dear colleagues.
Thank you, Dr. Alina. Thank you for this talk. I want to say that all the technologies mm, now in Crystal Vision Eye Clinic by Professor Igor Aznauran. More, if you have any questions or patients whom you want to refer for examination with strabismus, for restoration of binocular vision or for surgery, or with different other types of diagnosis as amblyopia, myopia. Dr. Igor Aznauran is in Crystal Vision Eye Clinic in Bahrain till August 6th. So you can connect with me in WhatsApp or write to their, I will ask to our IT manager to write my number to the chat so doctors will have no information to where to write if you want to refer patients. Maybe there are some questions about these technologies or about how to use in the kids, so we can answer them now till Dr. Alina is online now. As I see, there is no questions. Okay, so I would, okay, so I will write my phone number to the chat. So if any one of you have um, uh, want to refer patients, please write me to WhatsApp. I will ask how to do that. Thank you so much for being with us. Next Wednesday at 8 a.m., we also will have a webinar. It will be about amblyopia and vision therapy in kids with amblyopia, also different devices and approaches about how to make kids to see uh, more better and to have bright vision. Thank you so much. Have a good day. Um, I think, I hope it was very helpful to be here with us today in the morning during this webinar. Bye bye to all.